Hello everyone, my name is Warner Ha. I'm the program chair for the 2013 annual meeting in LA. Dr. Alvarez, the president for the SGO, and myself want to welcome you to the upcoming 2013 meeting. Based off the survey data from the last meeting in 2012 and carefully looking at that information along with my postgraduate chairs, Dr. David Cohn and Angeles Alvarez, there are several things that we learned that we think are important for this upcoming meeting. I want you to introduce some novel concepts that I think will be really important for this meeting. The one thing that we learned from our members and the attendees is that they definitely want to see more GOG-related studies, and as a request, I've encouraged all GOG PIs for clinical trials to consider submitting abstracts based on their clinical trials with the approval of the GOG to our meeting. The one thing I do want to point out is that abstracts that are submitted from the GOG to the SGO annual meeting have an extraordinarily high acceptance rate, not surprisingly because of its impact on the standard of care and everyday practice of gynecologic oncology. And in this past year, in 2012, there were 11 oral presentations, including an important seminal paper presented by Dr. David Miller on GOG 209 in the setting of endometrial cancer. So again, I would encourage all the principal investigators for various clinical trials through the GOG to really consider submitting abstracts, given that our attendees predominantly are GYN oncologists or work in the GYN oncology field, are very excited about hearing the upcoming findings and changes in gynecologic oncology. In addition to this, the SGO and the GOG have worked very carefully in terms of media relations and getting that information out to the public and most importantly to our patients. If you look at past information and past data, clearly GOG studies are one area that gets the most hits in terms of requests for information, not only from the media, but from the lay press and also from our patients as well. So again, we will continue to work hard to lobby for your abstracts from the GOG and to make sure that the public understands the importance of these clinical trials in terms of redefining the standard of care in gynecologic oncology. Now, what is very different about this year and past years is that instead of just submitting abstracts globally to the abstract submitter, there are various topics that we clearly defined as being important. And again, this is based on survey information from the 2012 meeting. And these innovative ideas, we hope, will shape in really the themes for the upcoming 2013 meeting. And more specifically, there are going to be 6 key concepts that we're going to focus on for the 2013 meeting, and these include development of clinical trials and novel clinical trial design, novel surgical techniques, quality of life survivorship, healthcare reform and healthcare outcomes, update on fallopian tube carcinogenesis, and lastly, palliative care. Again, these are the areas that you, the attendees, have prioritized as what you want to hear about and learn more about, and as such, we've actually asked abstracts to be considered for these specific topics. Along those same lines, we're not asking that you can't submit abstracts in other topics, and if you do, you can continue to submit abstracts as you did in years past. But as you go through the abstract submitter, and if you have an abstract that you feel fits these key topics, please check the appropriate category, and the program committee will actually look at your abstract more carefully. Now, in regards to the actual program and how we're going to design this, I want to credit Dr. Scott McMeekin from Oklahoma, who was last year's program chair, in terms of really, truly redefining how we deliver education for the annual meeting. And what we're going to be doing with these themes is actually incorporating not only abstracts, but also lecturettes and lectures, pro and con debates, as well as other presentations that would be relevant to these key topics and other related topics. So what you're going to see in the 2013 meeting are definite themes. We will continue to have our other standard courses as well, but this will be a major change in terms of how we deliver educational content. The other thing that's going to be very different about the 2013 meeting, for the first time ever, I've asked Dr. Memorial Littau from Memorial to head up the first ever SGO morbidity and mortality. And I think in our profession, we often hear about the great outcomes and the innovative surgeries that are accomplished in our field, but I think that we have a lot to gain from learning from the complications, including deaths, related to surgery, chemotherapy, and even radiation therapy. And I've asked Dr. Littau to actually head this effort, and I think it's going to be a very interesting discussion, since clearly quality of care and delivery of quality care are going to be increasingly important priority topics for how we practice medicine day in, day out. What we're actually extremely excited about is our presidential speaker. Our presidential speaker for 2013 will be Dr. Ezekiel Manuel. He goes by Zeke. And Dr. Manuel is actually a trained medical oncologist at breast oncology. He trained at the Dana-Farber, but his background and what he's really noted for is in the area of bioethics and healthcare reform. He was the former chair of bioethics at the NIH. He served as a special advisor to President Obama in terms of healthcare reform, and currently is the chair of bioethics at the University of Pennsylvania. He has written extensively in newspapers including the New York Times, the Wall Street Journal, as well as magazines including The Atlantic and the New Republic. What we're excited about Dr. Manuel is that he is truly an expert not only in healthcare reform and how we're going to deliver healthcare in the oncology world, but also can comment about some of the bioethical dilemmas that we deal with in terms of managing our patients with gynecologic malignancies. So we're really excited about having Dr. Manuel come and speak at our meeting. So again, the abstract submitter, the abstracts were opened on Monday, July 23rd, and will continue to be open until September 17th, which is a Monday. Again, I would highly encourage you to submit abstracts. You're not required to submit abstracts in these key topic areas, but if you do, please check off that topic so our program committee can actually look at your abstract carefully for consideration, as that these, again, are high priority items for the 2013 annual meeting. And thank you very much, and I look forward to seeing you in LA.